So what is hyperstimulation and how do you prevent it? So when we stimulate women to get eggs for IVF, we're just giving them a higher dose of the gonadotropin from the pituitary gland that the pituitary gland would normally be making. And that way we wind up getting extra eggs. Now with women, and it's called hyperstimulation. But we believe that the best way to do this is very, very minimal hyperstimulation. So you can hardly even call it hyperstimulation. We call it minimal stimulation. But hyperstimulation can be very dangerous in a woman who has a lot of eggs because you're just getting so many follicles to develop eggs. And when you mature them with HCG, they begin to secrete massive amounts of cytokines and estrogen into the peritoneal cavity. That causes fluid from all over the body to accumulate into your abdomen. So you're dehydrated, low blood pressure, thready pulse, sweating, not getting enough blood flow to the rest of your body, and yet all that fluid that's dehydrating from your periphery is going into your abdomen and pushing on your diaphragm and making it harder to breathe. And it's called hyperstimulation syndrome. We never get that anymore. It used to be a risk in 2 to 3% of IVF cases. It may happen even today with doctors that aren't enlightened. But now we make sure to use mini IVF and trigger you with Lupron for maturation of the eggs, not with HCG. And that way you won't get hyperstimulation syndrome, you won't get sick. However, if the embryo is then transferred in a fresh cycle at the same time, then the pregnancy itself can stimulate all those follicles. And again, you get a very dangerous hyperstimulation syndrome, which can be fatal. So you want to freeze the embryos and then transfer them 3 months later after the ovaries have come down to size. We don't want hyperstimulation syndrome to complicate a pregnancy. The reason we can talk so casually about freezing is the vitrification technique invented by our very close friend and colleague, Masa Koyama in Japan, and then even simplified and refined by us here in St. Louis. And with this approach to freezing, unlike the old slow freeze, it requires a great deal of expertise on the part of the embryologist. It's got to be done with exactly the right timing. But at least that way, we don't get any loss of embryos or eggs. And so we can comfortably freeze those eggs or freeze those embryos and transfer them later when it's safer to transfer them. It looks like our little baby Dawn is beginning to wake up from her pleasant sleep, you know.
Yeah, she's starting to get a little antsy.
Are you getting a good night's sleep, or is she waking you up in the middle of the night?
She sleeps a really good hour through the night. She sleeps, I would say, 2 to 3 hours, and wants to eat, and then she's back at it again.
You're a peaceful baby, and that's because you're peaceful. I've always said, even as a young medical school student, that a colicky baby usually comes from a colicky mother, a mother that's nervous. And a mother that's relaxed and isn't nervous has the blessing of a baby that isn't nervous.
Yeah, she's very calm. She was very calm in the womb as well. So I knew I was going to have a calm baby.
Fantastic. Great. Well, do we have any more? Sorry, do we have any more questions?
Yeah.
Is there any more questions coming?